Hello everybody, I'm Joanne Haigh and we do apologize for the late start. But of course we welcome our viewers and listeners to another edition of Face It and Fix It on CBC TV8, CBC Barbados Facebook and YouTube, and of course Q100.7 FM radio. On today's show we will speak with infectious disease specialist and manager of isolation facilities, Dr. Corey Forde, answers some questions and reemphasizes the need for the vaccine and the challenge that we spoke about on our last show. We also have with us this morning Professor Emeritus at the UWI and Honorary Counsel at the Q.E.H, Professor Sir Errol Mickey Walrond. He shares his observations of the pandemic and his knowledge of the unknown ethical side of medicine. Later on the show, physiotherapist at Harrison's Point, Dr. LYNN-MARIE INNISS, opens our eyes about the aftercare of surviving COVID-19, something that we don't hear about. Of course, you can call us on 228-5563 or 228-5562. Send us a WhatsApp message on 228-5562 or type in CBC Barbados if you're trying to join us on social media, and you can leave your comments there. When we come back after the break, we will be speaking with Dr. Corey Forde. Our first guest today is Dr. Corey Forde. He is infectious disease specialist as well as isolation facilities manager. Hello, Dr. Forde, are you there with us?
Yeah, good morning, sorry. It's a pleasure to be here. Morning and afternoon all mixed for me right now.
I can understand. First of all, I just wanted to get an idea and an update of what is happening. We know that the numbers, someone said to me, well, they dropped by 9 under 4. It was like 391 yesterday. Where are we? Are we getting any better?
Well, I think it's quite difficult to say at this point. I think one of the things from my mind, and I said it on national TV before, is that I think we need to we pay a lot of attention on the numbers, and that's important, but I pay a lot of attention as well on the amount of ill people who are within the facilities. And to my mind, that's more important. I think our goal as a country at this point is to try to identify those who are ill and get them to the appropriate management across the facilities across the country. And this is something that we really have been doing. When I say that, and I say almost tongue in cheek, that I think I'm really encouraging Barbadians who certainly are feeling unwell or uncertain as to their status, one, to get tested. And certainly if you've got tested and you know you're unwell, then you need to present yourself quite early I think one of the things that persons need to recognize is that the earlier you present yourself to the system, the better the chance for us, certainly to move ahead and get you to a stage where you can get back home with your families and continue your life as normal. The longer you stay, the longer the disease runs, obviously the greater the risk for complications. I think every single Barbadian would understand that. So I'm really encouraging people, to come out, get the appropriate medical assistance when that is required. I believe that at this point in country, for me certainly, with the number of deaths which has occurred in recent times, that one of the major challenges is that people are presented the system a bit late in the course of the illness, which gives us a bigger challenge. Mind you, we will fight with every breath possible to try to save as many people as we can. But as I always say, in this fight, a large part of this fight also is with the general public working with us and not working with us against us on these issues. And I think the early people come, the faster medical care we can provide. And I think, for the average Barbadian, they'll understand what that means.
Last week, Friday, at a press conference held by the Prime Minister, you were present and you made a statement. You didn't think about it. It wasn't premeditated. It wasn't scripted. And I think this is why Barbadians love you, because you keep it real and you're very authentic when you deliver your message. But you asked Barbadians, you said, look, you want to issue a challenge to them and to those who are eligible for a vaccine. And you pulled out a date. You said, and you laughed, you said, I don't like dates, but let's just say November 15th. You're asking Barbadians for those who can vaccinate, who are not, kindly step forward and get vaccinated. And I don't know if you're a Christian. I am not, but I believe in God. I'm spiritual. But you seem to be speaking from a place where when it speaks to you, you could feel it coming through. So I just want to talk about the challenge and that inspiration that you get when you speak.
Yeah. When I'm speaking, I always say one of the things is, when the Heavenly Father tells me to say something, I say it. And I've gotten a lot of backlash for that sometimes, but that's okay. I believe in power is greater than myself, and that will never change. And that's how I got where I am today from a poor, humble childhood. I think with regards to the challenge, really what this is a challenge for freedom, a challenge for us getting back to ourselves. And I say that and say one other thing as well. I believe everybody has a choice. I've said this a million times over. I don't believe anybody should be pushed to the sense that you have to do this or have to do that. I think it should be a choice. But in that context, I believe if we really want to get back to our freedom, and I didn't even think too much about it in terms of dates, and you saw my reaction on national television, which is I didn't really think too much about the dates. But if you want me to push it back to the challenge to the 30th into the 1st of December, then so be it. It doesn't matter. But I think I just want to really challenge Barbadians for the month of November to go and get vaccinated. Vaccinate for basically getting back things to normal. Vaccinate for your freedom. Vaccinate for getting the kids back to school. Vaccinate for your old granny who's in the house to try to protect her from getting unwell. You've seen a large amount of elderly people gone unwell, and unfortunately some of them have died, and my sympathies to their families, right? So I think we have to think about vaccinations in a different context. I mean, when you get vaccinated, we can get back to normal. For those of you who go on the dream chaser, I don't have that certain time in my life. Dream chaser, you want to go back to your clubs, you want to go back, to normal life as things were. Then the only possibility, I believe, certainly, in getting back there, is one of the possibilities, I should say only, but one of the possibilities in getting us back there is to do those things. Yes, you might continue to wear your mask. You might have to do that, but it means, the faster the majority of the population gets vaccinated, I think the greater the chance of us getting back to any semblance of normalcy. And that's just really the gist. The rest of the world is beginning to show us that in terms of what's going on across the globe, in terms of countries who've dropped restrictions. I'm not saying that we should, to a large extent. We still have to be very cautious as we proceed. But I think if we're going to get there based on what's going on globally, then this is one of the things. So I challenge every Barbadian today, every single Barbadian. And again, these are difficult times, but I challenge you, if you want to get back to normal, vaccinate for your own freedom in terms of getting things back to normal. Vaccinate for that purpose. Vaccinate into getting your life back together and getting those kids back to school. I think is traditionally important. I think one of the things that I've learned from working in the isolation center, if I can get, when I go into this zone, is non-scripted. And it's simply this. I've seen lots of little kids certainly in there, and I speak to lots of, I spend a lot of my time, yes, dealing with some ill people in facilities, but I spend a lot of the time talking to the people on the ground, the average citizen, the guys off the block. I spend a lot of my time doing that to get a feel of, what are their thoughts, where do they think things are going, and a lot of people really want to get things back to normal. And when I speak to them, I tell them, look, the only way we're going to get there is with your help. I don't think that we as medics can do it alone in terms of getting numbers down, etc. I think the help of the public is going to be critical. And this is why it's so important to vaccinate. But I think in those conversations, what I recognize is people really want to get the kids back to school. I think we will lose a generation in terms of education to the extent that it could be if we don't do these sort of things. And it's something that weighs heavily on my heart. And I always said that I grew up with my grandparents for most part, for most of my life. And it's really sad. I often, when I see many of the older people coming into the facilities, some of them very ill, some doing well, and many of them go home. Many I've sent lots of 90-year-olds home this week, believe it or not. But at the end of the day, it really pains me or hurts me inside when I see many of them, going through a struggle, which I thought that they might not have had to. This is not to say it. I have to say this because I think, you never give a false impression to the public. Everybody who gets a vaccination will not necessarily not get ill. If I told you that, I would be lying. That's not me. Right? We know at least 7% of people, depending on the type of vaccine, etc., can potentially get ill. But we know the 90% probably won't get ill at all. Maybe not even have any symptoms, may have something mild, for example. And I think that that's important to understand. And that's important to get across to the public. Some people say on this call, hey, so if I can get sick, it's like, and I give the example often, it's like wearing a seatbelt. The probability is you probably would be okay, but there's still that small possibility that you can get ill. I can't predict who those persons are going to be, but I can predict for sure that the likelihood is much less in that individual. And I think that's important. Like I said, that's just a very clear statement for me. And I really honestly think that, apart from getting vaccinated for all the things I mentioned before, get vaccinated for us as healthcare workers, because I think, like I said before, even on that interview, which I think is important, 100 people out there, for example, who are unvaccinated. And if I know for sure that if they get ill, and even 50 of those get ill, it puts pressure on my system for one day. It puts pressure on all the healthcare workers for one day. And then what happens the next day is the next question. So I think people have to understand that. The reason why the globe has failed tremendously, I think, certainly in the outbreak, was because healthcare systems were overwhelmed. And we understand that if you get vaccinated, that percentage is dropped, right? Not getting complicated at all. The percentage and the risk for you getting ill, ending up in ICU, for example, is like down here, right? So if you have less people presenting like that, because most population is vaccinated, it means we can continue our healthcare system like normal. All the diabetes and hypertension and people with strokes and stuff, they don't have to feel pressured or afraid to come to hospital because there are people who have COVID who are lurking around. And I think that's a very important point, apart from, for your own well-being, for the healthcare workers, for your family, for the kids, for granny, right? For yourself. I think it's important. I think at this point, as we go into a point where it's independence period, we have to go into a point of selflessness. I think that that's very important. Selflessness at this point, I think, is very important. I think for most Barbadians, I want you to step up to this challenge. It's a challenge for your health. It's a challenge for the health of the nation, in terms of the kids, in terms of the families, even getting back to church and getting back to normalcy. I think we can get back to a semblance of normalcy which everyone would appreciate. And this is really genuine for me today. We've had many rough nights in recent times, and I know we've lost a lot of Barbadians, and many of them old, who've really seen this nation to the point where we are today. It's given me the opportunity to even have an education at the level I have, and then to obviously use my knowledge which I've gained from the education I've gained in this country to help many countries across the globe, as I've done for the last few years. And I think this is a great opportunity, I think, to give back to help your country to get back to a sense of normalcy and get those kids back in school. It really breaks my heart on a daily basis when I see the number of kids and the number of people who are very, very unwell, who we fight with really hard every day, despite all the challenges that we're faced with.
Well, and I know that even as a doctor, you are human first. And people have to understand that. I think people just think, okay, they're doctors, they're accustomed seeing this. But for somebody like this, you know, you're human first. I can tell you, though, on a lighter note and a nicer note, that I believe that this challenge will work. And even if you don't get 10,000, the mere fact that one person can just reach out to another person, a vaccinated person to an unvaccinated person, this is the reason for the challenge. But the good news is I shared a little clip of what you said to some guys on the block, and this is how this started out when I got to film a friend of mine on the block. And then his video went out, I sent it out, and another guy on the block and said, man, wait, you ain't get stick. I see you again get stick. So he was like, yeah, man, I want travel. You know, I don't want to stick up. So the other guy asked him, so what was it like? He said, man, it was easy. I didn't feel anything. Had a little fever, took 2 paracetamols. Do you know that even though he didn't deliberately mean to do it, he actually reached another one who was now vaccinated. And that's how this is going to go, because I believe that we now need this grassroots movement, which started by you. And the reason I jumped on board, because I am a communication specialist, I marketing, etc. You're a doctor, you put out a challenge. How could I just sit there and not help develop the challenge with the talent that I have? You're using the talent that you have to save lives. And I reached out to SLAM this morning. We were on air talking about it. I called Starcom. CBC is on board. CBC TV and radio station. So I just got off to an earlier start. I said I can't wait for November. I start early. And plus, my daughter Sky's birthday is on Saturday. And I said, you know what, people talk about giving gifts. I wanted to do that. I've done it before, and I've reached out before the challenge. But I was so good when I found someone just right there who was willing. And we just want to make it clear to the public, as Dr. Corey Ford said, we don't force anyone. The challenge is really about sharing your experience of being vaccinated, sharing any information that you may have coming out from credible sources, from local stations, GIS, from the doctors, from the press conferences. And I want you to say one more thing before we go. I'm hoping that more young people will see your pleas and your press conferences that you hold. How important is that to you? Because I know you're not a PR person, but you know that a lot of these youngsters, they don't know who Dr. Corey Ford is because they don't get to see it. Final words?
Well, yeah, it's true. Many of them are saying it for being in the isolation facility, which is not exactly what I don't want, which is very sad. Like I said before, I spend a lot of time talking to guys, and they, like some of these guys, like I spoke to some of the guys at Foundation and Queens, and they're actually some of these guys really out there are like really, really smart. They ask some really good questions. We have some really good sessions. That's not my job to do that, but I spend a lot of time talking to them. I think we have to really change and channel the way how we speak to our young people. And being young, it's helpful because they understand me and they can relate. I think we have to change the way how we get to them. They have some really good questions. I was able to speak to several of them at Foundation School, and they said, look, Doc, I'm coming back up there. I'm looking for you. I could come here and get the vaccine. I can answer at that time, but I told them, you don't worry. You stay in contact with me. We'll make it happen. But I think we have to go to people where they are. I think that you have to go and answer people's questions and look after their fears. And the fears are there. The fears are real. But if you are able to answer them, logically, and work through with them, I believe that that we can get past this even faster. I think we really need to get on the ground and do some more groundwork with these young people, who I think many of them are super intelligent, and they're able to ask some good questions. We're able to answer them, lay their fears, and I think we'll do better as a country. And I use the opportunity today to shout out all of the young people out there who are going to get vaccinated within the month of November. I'm giving it to the end of November. If I can change my date, because it wasn't a fixed date. I don't even know. I just came off the top of my head with a date. I'm giving you a challenge today. I challenge you today to go get vaccinated for your country. Let's get back to normal. Thanks.
Thank you so much, Dr. Corey Forde, very, very much. And it's my pleasure to be on board with this challenge, and I certainly will do everything I can to help. Thank you.
Thanks.
Michael Sack.
Welcome back to Face It and Fix It. That was an excellent interview with Dr. Corey Forde, and I'm looking forward to many Barbadians participating in that challenge who are not vaccinated. Our next guest, another doctor, and I must say, growing up, I always heard this name, never got to meet the individual, and I am very excited today to be the person to be interviewing none other than Professor Emeritus at the UWI and Honorary Consultant at the Q.E.H, Professor Sir Errol Mickey Walrond. Hello, sir.
Hello, how are you doing?
I am well, and it's a pleasure. I've heard your name over the years, always wanted to meet you, and when I heard that I have you as a guest this morning, I was actually very excited. I was like, finally, I get to meet Dr. Walrond, and we know you for many years with things with HIV program and the campaigns and everything. We've heard you, so welcome, sir. It's a pleasure to have you. We want to know.
Pleasure to be here.
We would like to know your thoughts on the pandemic right now, in terms of if you can share your observations and some of your knowledge about this pandemic. Your observations first.
Well, I think this is truly a pandemic, because if you watch what has happened, it is around the world, and you have had a variety of actions in different countries related to this, how one would try to control this. And it is a particularly difficult one, because it's shown itself indeed very easy to spread and very difficult to control. And I think if you look at the various things that have been said in different countries.
So, Dr. Walrond, could you have 1 sec, because we're just getting a little feedback here. We just want to correct it for a second there. So we do apologize for the interruption. And we will be right back with Dr. Walrond in the meantime. I just again want to remind Barbadians of Dr. Corey Forde's November vaccination challenge. We don't force anyone, but we certainly want to share any information with individuals who are hesitant right now. Just reach out to your neighbor, reach out to your family member, reach out to your girlfriend, your boyfriend, anyone, your workmate you can actually reach out to. And again, it's not forcing, it's just explaining the procedure, what you went through, and you then let them know where they can go and get a vaccine. And again, as Dr. Forde said, it's a selfless act. In other words, we can't be selfish, especially at the time leading up to independence. We got to do something for ourselves and for someone else. And if it means taking a vaccine in order for life to be restored, in order for lives to be saved, in order for children to go back to school, it may not go back to normal 100%. It may be a new normal. But the point is, I think that we are all tired. And because we're tired, tempers are flaring somewhat. People are upset over things that they normally would not be upset about. And all of that is the frustration of having COVID-19 around. And again, people understand the fears of those who may not want to be vaccinated because you figure that there's something in the vaccine. I encourage you to get the right information. It is so important to find the right information. And always remember something. If you are listening to people who are not of a medical nature, if you ever caught COVID, God forbid, would you want that individual up at Harrison's Point saving your life? You probably wouldn't. You would want a doctor there present. And that's for all ailments, not only just COVID. We listen to our doctors, we normally do, and it's shocking for me and for many others why we would not listen to doctors now all of a sudden as if this was some one big conspiracy. And so I just wanted to share that with you, and now we are ready again now to join Dr. Professor Sir Errol Mickey Walrond. Professor, welcome back. We do apologize for that slight little interruption. But yes, you were sharing with us your thoughts and observations of the pandemic. And my apologies for interrupting.
I think that although various pandemics have had political reactions because they affect the populations as a whole, I think what we have found is that this particular one has had some very severe political reactions, and they're being communicated around the world because of our very interconnected network these days. I sometimes say that we live under the shadow of the satellite, and therefore we get all the conflicts and so on that go on, particularly those that come out of North America. But North America is not the only place where we've had a lot of conflicting views and political reactions around this epidemic.
All right, okay. So you, changing the subject just for a second there about not only the pandemic, but the diseases, the NCDs rather, that we have a lot of in Barbados. I had a conversation with a young man who spoke about the passing of his father. And he felt that had not been for the pandemic, that his dad would have been alive. He felt that the focus is on COVID. He believes that entering the only hospital, in the major hospital, Q.E.H, that the fears are so real that when you're being tested and you have to wait, no one wants to touch you until they know if you have COVID or not. What are you seeing now with the NCDs in this country as it relates to COVID, and are people being impacted in a bigger way, more so than the virus itself, with the NCDs?
I think that observation made by the young man that you interviewed is obviously very real. And it is one of the defects that we have that's being created out of the response that we have had to this pandemic. The authorities have tried to decide early in the pandemic that the Q.E.H would try to isolate it as much as possible from this pandemic, and we could argue whether the way they went about that was feasible or not. What it has done is, quite rightly, it has dislocated the whole of that healthcare system within the hospital, and naturally that will affect the care of patients. And this is one of the reasons why it is so absolutely urgent to try and get this whole pandemic under control, because it is not only the COVID disease that is being affected, but everything else that is being affected. When I was in practice, my primary craft was that of surgery, and I know from listening to my surgical colleagues who are still working both here and all around the Caribbean, the great dislocation that that has come to all the surgical services, although they have struggled to try and continue to treat the most urgent cases, and particularly those patients who may have cancers, but all the urgent cases, they struggle to try and treat them. The other thing, of course, is that the patients who are ill with COVID occasionally need some surgical procedures as well. And this has proven to be very difficult. And indeed, here in Barbados, I think at one occasion, rather controversial.
Well, I've certainly been hearing some of that, actually, again, recently of another patient requiring surgery and tested positive coming in, and some delays occurring and having to stabilize the person. But my question is, what happens to emergency surgery? And I mean like emergency, literally, you're coming in the hospital, maybe it's gunshot wounds. What do? Do you have time for a test? Do you not set up the operating theater and just do it?
Well, that happened to be the subject of some controversy here in Barbados, but it has been the subject of controversy in other places. The first place that we heard about the difficulty with emergency surgery in the Caribbean was in a story out of Jamaica, where a pregnant woman requiring an emergency cesarean section found difficulty, or the doctors looking after her found difficulty in getting a hospital to accept her for the emergency surgery. It was eventually done, but unfortunately, the patient did die afterwards, probably because it was done rather too late. So these are matters that are very serious, that have been dislocated by the COVID pandemic. I would say that one of the possible causes of this serious dislocation is that in the emergency response to the pandemic, it is possible that there was not sufficient consultation done with all of the particular disciplines that could be involved to make sure that they would have what they need to be able to do their treatments safely. Surgery is a particularly difficult area in terms of the COVID patient, because the virus is passed in the air passages. And for those patients who have to have surgery on the head or on the nasal passages, or who have to have general anesthesia, this produces a great danger for the people, the staff, the surgeons, the nurses, the anesthetists, the attendants in the surgery, who are having to operate on them to save their lives, and things that have to be re-equipped is that the operating theaters would have special equipment to be able to extract the air from the patient and onto the outside, so that the virus particles have little or very little chance of infecting the attendant staff.
But if I can ask you there before you move forward, when you were doing surgery in this environment, the PPE, you mean they look like people from space. They're fully covered, everything. Are we saying that that is not enough protection when you're doing surgery?
The PPE prevents direct transmission. So if I was standing in front of you and I had COVID and I coughed on you, it would prevent that direct access to you. But you have to breathe, and the air has to come from somewhere. And when you are operating in a closed environment and the air is circulating, it is going to get to you through that, through the passages that allows you to breathe. All right. So unless you are going to go into a diving suit, you have to have special extraction for the air, for the COVID infected patient. And that's why the operating theaters had to be specially re-equipped in terms of their air conditioning, which they normally would have what is called a positive pressure atmosphere, which will bring air in and pump it out along the floor. That's what we normally have in an operating theater. In this case, we had to take the air from the patient and negative pressure pump it out through ducts so that it doesn't reach the staff.
Okay, well, we got to take a quick break, and when we come back, more with Professor Walrond. We'll be back. Welcome back to Face It and Fix It. If you're now joining us, we are speaking with Professor Sir Errol Mickey Walrond, and we're discussing the COVID pandemic, and he's sharing his thoughts and views and observations with us. I want to ask you about going into the hospital, an accident emergency, and assessing the triage aspect of a patient in this environment and how critical that is. Finding out what you need to find out, what's happening versus what's happening then in the body COVID related wise.
Well, clearly, in order to try and protect both the staff and other patients, what you need to do is, if you want to screen the patients who are coming in and to ensure that they do not have the virus. And what has happened is, as I understand it, when a patient is suspected of having COVID and they have been tested, the test does take some time before you can get a result. And unfortunately, on some occasions, it's taken as long as 24 hours. But I understand that in the hospital, most of the time, it will take several hours, but shorter than the 24 hours that it may take. Whilst you're waiting for that test, you are put in a room in isolation. And there were complaints originally that that room was very uncomfortable. I understand that it has been made a lot more comfortable since those complaints came. And that is something that I think authorities must take on board when they get a complaint, not just to say, look, these patients are complaining, but I've done everything for them, but to find out what they're complaining about and to try and rectify it when they have a legitimate complaint. The problem with the COVID pandemic is that a number of patients who have the virus do not have any symptoms. And this has been, in my viewpoint, one of the points of weakness in the system device, in that what the patients are screened for having symptoms for COVID. Now, I know that there are resources that are limited. And in fact, if you were to screen everyone, that would mean everyone coming in as a patient would have to have a test. But I think one has to recognize that if you are dealing with a disease that is asymptomatic for a lot of the patients, that if you set up a screening mechanism for those who have symptoms, you will miss some of those. And therefore, you have to have mechanisms within the hospital to try and ensure that there is little or no transmission that is possible between patients and between staff and patients.
So when the concern, I understand the concern about the transmission between patient to patient and patient to staff, but what concerns me, patient A comes in with a heart attack. What time do we have to do all of that in an accident and emergency department? What happens to those people?
Well, yes, that's the difficulty that the accident emergency staff face. And what I would hope is that any patient that is, and I think what happens now is any patient that does not have symptoms of COVID but has a heart attack, they will get the treatment as soon as possible for their heart attack. All
Get the
right.
treatment then.
Now,
Go ahead.
if you have the combination of COVID symptoms and the heart attack, that's fortunately going to be rare, and there the difficulty arises. That patient may be sent to the COVID treatment facilities at Harrison's Point. But I would say that although they are well equipped to deal with the illness of the respiratory illness of the COVID patient, I don't think they are as well equipped to deal with all of the other problems that may arise in a patient. In other words,
dialysis, for example.
All the things that need patients that need to be in an intensive care unit. There are no imaging facilities down there, for instance, and so on. So that it is always a balancing act, and I think that if the scenario that you present, then I think we have to deal with the most important problem, which is the heart attack, and at the same time screen, protect oneself and other patients as much as you can from the COVID, whilst you give the patient the best possible treatment.
Because even with the rapid antigen test, that still is about 15-20 minutes to wait for the results. And that's 20 minutes of a person's life that they may not have. It's a very difficult situation for people who have NCDs. This is why I guess it is important for people to stay away from COVID or get vaccinated, which will now bring me into the discussion of vaccinations with you and your thoughts about the vaccinations. We know we've had about the vaccination process, the types of vaccines that we do have in this country and available to us. But the pushback that we have been getting over the last couple of months from the time that they got here, what are your thoughts first about what we call the armchair doctors, the internet doctors or the Facebook doctors who constantly try to weigh in and compromise, or should I say question, the information coming from our very own doctors? What are your thoughts about what you have been seeing over the last couple of months regarding these such individuals?
There has always been, from time immemorial, alternative views and what we now call disinformation about medical treatments and about vaccines. This is not the first time. What we have at the moment is that we have the mechanisms for spreading that disinformation is very much easier, and therefore we, I think, to combat it, also have to use extra efforts to combat that disinformation. Now, I think that apart from the efforts that have been made, I think that one has to, as we did in the AIDS pandemic, as it was, we have to use all means of communication. It sounds quaint today, but I think written communications have to be used as well as the radio and the television and, of course, the social media. And most importantly, I think one needs to get out there and have face-to-face meetings, particularly with those groups that are that have real doubts about the vaccines. Because I think when you give the people the opportunity to ask you questions face to face, they have the opportunity to assess you as well. Because, you know, people do make assessments about the people who are giving them messages. They have the opportunity to assess you face to face and to be able to see whether your message really is the genuine one, or are you, as the detractors say, just trying to fool them into taking these medicines, which they say are unproven, and all of this. So I think we need to have a greater effort with wider means of communication, and particularly some face-to-face communications with those who are particularly resistant, because I find that that would be probably the most effective.
A couple of weeks ago, I believe you were on radio 100.7 with Kimberly a couple of weeks ago. I believe you were, and we talked about some of the long-term effects of COVID-19, and people are probably going to ask, Joanne is still on this subject about erectile dysfunction and hair loss and all of these different things that we understand that can happen as a result of having COVID. You want to...
Well, yes,
yes.
I don't think I was the one on that program, but, you know, I think, again, you have to answer those questions directly. You will not be able to give complete answers for everything that comes up, because we are still in the learning phase for this particular epidemic, as happens with all pandemics. We are learning as we go on, and you can only give the best possible information. Let me just say that one of the things, erectile dysfunction is obviously very important.
Go ahead.
Is obviously very important to men, and young men in particular. And you may, in fact, get erectile dysfunction as a consequence of many diseases, all right? And therefore, and it is likely to be recoverable if it is as a consequence of the COVID illness.
So, okay, and finally, I want to ask you your concerns and your thoughts about how can we get out of this? Do you see it happening in, you know, nobody wants to put a date on, but we remember the last pandemic 100 years ago, I believe it was Spanish flu. It took them about 2 years to get back to some level of normalcy.
You mean the last respiratory pandemic?
Yes, respiratory pandemic.
We've had pandemics since then. We've had polio, we've had HIV/AIDS, you know, which just swept the world.
So final words at you, sir. What would you like to say or recommend? Do you see an end to this?
We have developed vaccines at a record pace because of the improved technology that there is there in the laboratories around the world. However, in spite of that, we are still learning as we go along. And I think my best hopes are for continued work with the vaccines. And I will stress that although we can't say that they're going to be perfect because we don't know, we have to continue working because it's the best thing that we have. And it is showing itself to be fairly effective, perhaps because of some of the variants of the disease, not as effective as we would have wished, but is still effective. And I think we have to push on by all means of persuasion that we can to try and get everyone who is eligible for to be vaccinated to be vaccinated.
Thank you.
It is
Go ahead.
the one thing that I think will get us out of this. And if we can do that, I think we can be out of this in 2 years.
2 years starting from when it started, or 2 years starting from now?
I'm starting from now because we are still trying to get the vaccine period. And as you see, we are right now in this country, we are in a rising phase of infection. And I say we need to get the vaccines on board and getting. And I say 2 years because I am being cautious. Mm-hmm. I wouldn't like to promise someone 6 months and then, which I would welcome.
So what you're doing is what we call in my business that you under promise and over deliver. So basically, if you say 2 years, it might really be 6 months, and then it looks even better. But I want to thank you very much, Dr. Walrond. We are out of time, unfortunately, and I would love to invite you back to continue our conversations, not just on COVID, but healthcare in general in this country. I want to thank you.
Be happy to.
Thank you so much. That was Professor Sir Errol Mickey Walrond, Professor Emeritus of the UWI and Honorary Consultant at the Q.E.H. We'll be back after the break. Welcome back to Face It and Fix It. Excellent discussions this morning. A lot of information for those of you who may be hesitant about taking the vaccine. Our next guest, Dr. LYNN-MARIE INNISS, a physiotherapist. She has returned to Barbados to assist in COVID care, and she is located at Harrison's Point. Hello, Dr. LYNN-MARIE INNISS. Welcome to the show.
Good morning. Thank you for having me. Good morning to our viewers.
So when they said you returned to Barbados specifically for this task or other reasons?
It was a combination of things. One was because I wanted my children to be able to enjoy in-person school. That was snuffed out very quickly. And the other was I felt a burning need to be here to assist my colleagues in the fight.
All right, so what exactly is your role at Harrison's Point as a physiotherapist in a COVID environment, COVID related? What happens?
So currently working in primary and secondary isolation. As a physical therapist, we do not only look at movement, but we also look at breathing, respiration, because if you can't breathe, you're not alive. So the whole point is to assist patients in being able to get the oxygen in, get the air in the most efficient way possible, in tandem with the doctors, whether they're on high flow, if they're ventilated. We just want to expand the lungs. And we also want to ensure that the patients don't become overly debilitated, because once you can't breathe, you tend not to move. Therefore, you're going to lose muscle mass. So it's really important that you get the patients moving as much as possible to reduce any side effects of inactivity.
So we often hear people telling us about these breathing exercises in yoga and meditation. Is that what we're talking about, or is it something a little bit more technical than?
It is a little more technical. What tends to happen is when you are having difficulty breathing, I'm going to get a little technical here, but I'll try to use as generic terms as possible.
You got me conscious now of my breathing now, by the way, so I'm going to think with you in case you want to share any exercises so I can breathe better, but
I will.
Continue.
Sure. So one of the things is, let me go with how normal breathing works, and then I will go into what happens when you have COVID or any respiratory issues. So normally when you breathe in, the chest rises and the ribs flare. And you also get the abdomen moving as well. So they work in tandem with each other with every single breath. What happens when you have COVID or any respiratory issues which limit you from being able to breathe, or you start to breathe shallow, is you tend to use your accessory muscles, which is the muscles in your neck, your upper chest, your shoulders, and you don't use the abdomen as much to help you to get the air in. So what happens is the diaphragm, which is that big muscle underneath your lungs, it doesn't move as much. So the lower part of your lungs can't fill up with air. And if you don't breathe deeply, then the basic activities will make you short of breath. And then oxygen then cannot be transported around your body. Therefore, you will constantly feel short of breath, and by extension, have a high level of fatigue.
Wow.
So for us, we try to teach patients to basically turn off the accessory muscles and to turn on the diaphragm. So we do, like, for example, diaphragmatic breathing or abdominal breathing, where if you want to try, you can put your hand on your tummy.
It's a lot of tummy, right? But I'm going to try.
You can that's okay. The diaphragm doesn't change because of that. And you want to put your other hand on your chest. So you want to put it just by your breastbone. Right. And when you breathe in, what I want you to do is when you breathe in, try to make your lower hand that's by your tummy rise with the in-breath. So take a nice inhale for me. And you see how you shrugged your shoulders? People that have COVID, their shoulders come like all up to their ears. So I want you to like relax your shoulders. Okay. So imagine you're pulling your shoulders down to your tailbone. Okay. And when you breathe in, push your tummy outwards as if you swallowed a melon. So you will still get some movement in your upper chest, but the majority of the movement will be concentrated in your lower tummy. So in through the nose.
So I don't move my shoulders. Big. I push my shoulders down. Keep them down.
Don't lean back. Yeah, don't lean back. Don't shrug your shoulders. Just sit upright, put your feet flat on the floor, and when you breathe in, let that tummy push out. In through the nose, beautiful, and out through your mouth. That's it. Try it again for me. In through the nose, make your belly big, and out through your mouth. That's it. And that nice, relaxed breathing is what we're trying to achieve. When you can't breathe, anxiety is triggered, and anxiety in itself triggers hyperventilation. So it's like a never-ending cycle. So we step in to break that cycle, because if you can break the cycle, then you can reduce the anxiety, you can reduce the respiratory rate, therefore the whole process becomes more efficient.
When is it true that COVID patients, they're not able to lie on their back because of the lungs, and they probably put them a little bit more face? That's not true?
I want to debunk that myth. I will simply put it this way. You ask patients to lie on their tummy or on their side, and they lie on their back, as opposed to that they can't. We would prefer if they didn't spend a lot of time on their back. I think that's a better way to word it.
So,
when you lie on your tummy, when you lie on your tummy, what happens is the lower part and the back of your lungs, because the lungs are divided into segments, okay? So each segment, okay, let me backtrack a little bit. Imagine the lungs as a head of broccoli turned upside down, okay? So the florets will be like the air sacs, and they face in different directions. So if you imagine it like that, when you're lying on your back, the part that is touching the bed is constantly being compressed. Make sense?
Okay, yeah, yeah.
So when you flip over, the part that is constantly being compressed is now given a chance to open up. And we call that postural drainage, where the stuff that's stuck inside there is allowed to flow out. And studies have shown that when patients lie on their tummy, we call it awake proning, when you're not intubated and you're able to interact. When you're awake and you spend a lot of time on your tummy, it can be a minimum of 1 hour. We prefer more than an hour, but some people just can't tolerate the position. So if you spend a minimum of 1 hour, studies have shown that your oxygenation will improve and remain improved once you do it consecutively.
That's what I wanted to mention, and about the oximeters and knowing your oxygen levels and how you can improve it. And to the viewers and the listeners who may be at home right now in home isolation, you may not have any symptoms, but in case you start feeling something, and you're waiting for someone to call, and you're waiting for someone to come, call immediately. But is there something that they can do, or even just for healthy practice? Because I don't have good habits, and I know that my lungs probably will be somewhat compromised. But again, is it true that the lungs can actually repair itself if you practice better habits that don't compromise your lungs?
Right. So that question has many facets, but I will put it this way. Whether you are symptomatic or you're asymptomatic, everybody can benefit from prone lying. And I can use myself as an example because I had COVID in May of this year. And I did not have any breathing symptoms. Every time I checked my pulse oximetry, the saturation, oxygen saturation, it was 100%, 99%. However, when I then lay on my stomach and I took a deep breath in, I couldn't stop coughing. So clearly there was some level of collapse in my lung. And every day for over an hour, I would spend some time on my tummy, and it will come up to 100. I would take 10 deep breaths, and then I would just take a little nap and then get up, and I will feel a whole lot better. And I will encourage anybody, you don't have to have any symptoms. Once you've got that diagnosis, feel free to spend some time on your tummy every single day. Take some nice deep breaths and keep those lungs nice and expanded. If you're finding that you are having difficulty breathing, you do need to alert some person. Don't wait until it's out of hand before you call for help. Out of hand means once you get to 95% and you're downward trending, that's a sign that you need to get help.
All right, so let's do this again for the sake of those who are at home right now, possibly in isolation, those who may just want to know, what can we do to increase our oxygen levels, that little oximeter?
Right.
Again.
Even if you don't have an oximeter, you can use your phone, by the way. There are several apps that you can use on your phone.
Okay.
I'm not putting in a plug for Samsung, but where the camera is, the S Health app actually does have a pulse oximetry app in it where you can measure your saturation and it can record it for you throughout the day.
And here I was about to ask for donations for the oximeters to give away on the show. Now we have an app. Okay, good. I'm glad you stopped me there.
All phones don't have it. All phones don't have it. So they will still be welcome. Please send some pulse oximeters to the show.
Consider it done.
Right. So So yes, so you lie on your tummy. For those females who've got large breasts, men, women who've got large tummies, it is not the most comfortable thing to lie on your tummy. So pillows are your friend. You can put a pillow by your chest. You can put a pillow under your tummy. It's okay to have that padding to make it more comfortable for you. You can put your hands above your head like this, anything like that to encourage compliance with the position. You can turn your head. If you've got neck problems or you get numbness and tingling in your fingers, you can put your hands at your sides with your palm facing up behind you. There are different ways that you can go into the position. You don't even have to go completely flat on your tummy if you simply can't tolerate it. You can go slightly on your tummy and turn away slightly, okay? You're going to spend at least 1 hour in this position. And while in this position, try to take 10 slow, deep breaths. A little deeper than that.
For our viewers at home and listeners, deep breath, 10 seconds in.
Not 10 seconds, 10 breaths.
10 breaths.
Try to pull in. Yes, so you want to pull it in and hold for approximately 3 to 5 seconds, depending on how short of breath you are. 3 to 5 seconds. You're taking it in and holding. And then you slowly let it out through your mouth.
And this is while you're lying on your stomach with
on
a
your
pillow
tummy. That is correct.
underneath you. So maybe this is why that my breathing may not be so bad, because I spend a lot of time on my tummy watching Netflix. That is true. With a pillow.
Well, there you go. That's fine. That's fine. That's fine.
It's true. And so some people assume different positions. I can't lay on any other position. I have to do my stomach. And the pillow is actually just right there. So to the viewers and listeners at home, in home isolation, if you're not, doesn't matter. These breathing exercises that you just described to us, lying on your stomach and taking 10 deep breaths, you're saying can increase the oxygen circulation.
Oxygenation.
Oxygenation.
That is correct. Yes.
Okay. Yes. Wow. Something as simple as that. So if you are 95 and you go and do this, you should see.
You should come up a bit.
A difference, because it fluctuates somehow.
That is correct. It will fluctuate because of activity. If you are already in a low oxygen state, muscles require oxygen and nutrition in order to remain healthy. So once you start to move, you're increasing the body's demand for oxygen. So if you continue to draw down on the oxygen, but you're not replacing it, that's when you start to run into trouble.
Wow. So the physio that you do is based all respiratory at Harrison's Point? No, so let's go into the other things that you do.
So we're looking at breathing mainly because, as I said before, if you can't breathe, you can't function. We're also looking at reducing the effects of immobility. We want to maintain your muscle strength. We want to maintain your muscle length. And we want to ensure that if you've got any other pre-existing conditions, for example, poor circulation, diabetes, high blood pressure, that it's not worsened by inactivity. For example, when you become deconditioned, you will find that your exercise tolerance reduces. So something as simple as getting up from lying down, it can trigger you to become dizzy. Your blood pressure might fall significantly. Diabetics need to exercise. It helps with the body's uptake of sugar. So if you're not moving around, you will find that your blood sugar levels are going to be pretty high, which in itself is a problem.
Wow. So on a daily basis, is only Harrison's Point, or do you have to move around then to the other isolation facilities, or are the ones at Harrison's Point would be the most critical?
The ones at Harrison's Point are the most critical. It is an ICU setting in primary, and secondary is like a step-down ICU. We do not have enough staff at the moment to facilitate going to the other, we call them remote locations, but they do need persons to go there as well too. Okay,
so we know the breathing, we talked about the diabetes, and let's talk about regular physio though, therapy after an accident. I can tell you this, again, this is not vaccine related, but I got the vaccine and I already had problems in my left arm stretching because of age. The joints need a little bit of oiling and they're probably drying out a bit. So I was not, one day I just could not raise my arm. Well, I don't want to do it on TV. I could do it. I could raise it. But I realized, wait a minute, my arm is not going any further. But then I got vaccinated on my left arm. But I told the nurse, my left arm is already messed up. Give me the injection here. Don't worry to mess up the right one. And, but it didn't contribute to it being, bad. It just happened, it was the vaccine pain and it was the stiffness. But I did a little bit of exercises and I tried to stretch and put my hands behind my head and push back.
Right.
And it's actually a little bit better now. So that type of physio happens. I don't know. Yes. There are people who just wake up with stiff
frozen
neck.
shoulder, yes.
And people would tell you, girl, you're sleeping in front of the fan. I don't know. I'm not quite sure. But we're going to have to take a quick break and we're going to talk about other physios that we can help people with their conditions and how best they can fix them. We'll be back after the break. Welcome back to Face It and Fix It. We are speaking with Dr. LYNN-MARIE INNISS, physiotherapist. She is based at Harrison's Point. Her role at the moment is dealing with COVID patients and assisting them with either respiratory therapy as well as physical therapy at Harrison's Point. And even though we are speaking about COVID, we know that there are other things that are going on that require physiotherapy outside of COVID. And from time to time, or eventually, I would like to see more of these issues addressed. So I'm glad that you're here let's talk about that. Now, before the break and during the break, so I was trying to do this and push, but I realized it's not as flexible as this one. I'm not telling you to diagnose me, but I'm just saying that it happens.
I already have.
Oh, talk to me, girl. Talk to me.
Sorry.
Tell me.
I think you have frozen shoulder based on the etiology and the history that you gave. Of course, it will require some imaging and physical examination so that we can really pinpoint and see where the issues are. But you do have some shortening of the pectoralis, and that's why it's difficult for you to extend.
Just all of a sudden.
We will go further. When you've booked your appointment, we will go further into it.
This is good. Hook me up. So the other people know that there are people right now with their knees. There was a patient the other day, family reached out to me that they thought it was a knee infection or something like that, but they couldn't walk. And we always hear about Barbadians. I mean, people all over the world, but I can talk about my Bajan people. knee problems, fluid, everybody's talking about fluid in the knee, and
Yes.
arthritis and things like that. So when you
Yes.
see people's fingers stuck like this, is that it? Is there any therapy to straighten out the joints when they become a little crooked?
There is, most certainly. It all depends on what the underlying cause is, and how early treatment is started, if it's an autoimmune condition versus if they've got, is just from an accident. What you're describing is called contractures. Persons who have autoimmune diseases are more prone to having these kinds of presentations. That's the best word to use, presentations. And I still encourage people, despite COVID going on right now, to still seek out their GP, still seek out your specialist for your referrals, because physical therapy has not stopped because COVID is happening.
Oh, I agree with you 100%. And I think that we need it more because people are at home.
Most certainly.
And a lot of depression going on. And a lot of aches are happening all of a sudden, and you don't
That
have
is
to be going
correct.
through menopause for this to be happening. And young
That is
people,
correct.
and I remember going for the same shoulder, a little bit of therapy, got a massage, but one of those deep massages, and I'm thinking,
Yes.
but that was a whole different set of pain when I got home, though, because I was
Because
sore.
it was deep tissue and the area was inflamed, and you added trauma to an area that was already inflamed, and that's why it hurt even more afterwards. But a day or two later, did it feel better, or
Yes,
did it still
it did.
feel
When
pretty
they
bad?
did tell me to get this warm blanket thingy.
Compress, yes.
Compressor.
Yes.
Well, compress
heating
thing.
pad, yes.
Heating pad, that's the name. So I went, I didn't get the heating pad, but I went to Quartz and I found this shoulder thing.
The
And
electrical one.
And
yes.
it has heat and it's vibrating. So listen, I was so stressed yesterday. And I couldn't take any more calls or anything. I ran into the bedroom, put on Netflix, and I put it around my shoulder for the first time.
Yes.
Just to relax, just to relax.
Relax. Yes.
And then I put the heat on
and that's
too.
Yes. That's a thing that's happening a lot with people now. And I wouldn't say now as in it just started, but since last year, there have been a lot of people, you can't go outside to exercise, they weren't able to, and then when it became time that you could come outside, they were afraid to come outside because they don't want to interact, they don't want to get COVID. And that's really, a lot of people would have been exercising before, so they were able to keep injuries at bay in terms of keep themselves healthy, I should say. And therefore, they were less likely to injure themselves, because there are some people who are weekend warriors, which basically means that only on weekends you exercise hard, for lack of better terminology. And now you find that people are not taking care of themselves as much as they did before, which would affect their mood. And therefore, if you spend a lot of time sitting, you will be at a higher risk of injury or having some form of a work-related issue later on in life. So exercise is really important.
I'm glad you said that. And over the years, so many people tried with me. Honestly, people tried. I started the gym, and a lot of you listening and watching understand where I'm coming from. You're going to buy the outfit, we're ready. We go first day, second day. Then all of a sudden we start finding excuses. Only by the grace of God, I believe, and let me knock on wood, seriously. I'm terrible at it, but I will let the cat out the bag. My daughter, Sky, she's going to be 22. I said on Saturday she has Down syndrome, but she's a little bit heavy set. And I said, okay, I buy you this elliptical bike. And it's coming home today, Sky, but I'm using it too. And I know feeling, I don't know, and since the interview I had too with a lady called Jenny Babb on Monday about menopause, I just started to feel a little bit, you know what? Let me just get up because I work a lot with my mind, my brain. I'm not, I'm into any physical work. It's constant calls, meetings, making decisions, getting it done. And that is so stressful, especially in this environment, trying to keep your daughter safe, worried if she goes over to her dad's house, worried about who's coming over to my house, if even they're coming to deliver something, mask on, it's a lot. But between
Yes, I
that
do.
interview with menopause and then even yours, and we got a lot of feedback I did from the menopause interview and more than likely this one, mental health is so connected to physical, and the mental
Yes.
is
Yes.
probably the
Yes.
best way to deal
Yes.
with this environment that we are in. This is why,
That
as a
is correct.
sidebar, I am started my Christmas countdown because I'm doing the things that would make me happy, and I encourage Barbadians to do that too as well. So exercises
Agreed.
now, I want to just talk about exercises. Even with long
Sure.
COVID, we heard about effects of long COVID. So you've gone home,
Yes.
you don't have COVID anymore, but you start feeling a little bit out of breath and you start getting some issues. Can they do the same
Yes.
exercises as what you would have probably showed the patients when they go home?
No. So this is a whole new kettle of fish.
Okay.
Long COVID, even though we've been in the pandemic almost 2 years now, long COVID is continuing to evolve. The incidence of it is still being established. The fact that it affects children different to how it affects adults is also still being established. So what symptoms you will see in adults will not necessarily be same in children. You cannot necessarily exercise the same way. It is a very individualized kind of thing, meaning that it affects several systems of your body. There are over 205 ways that it can present itself in adults. And you are getting the main three would be fatigue, shortness of breath, and brain fog. Brain fog meaning you can't focus on anything, or if you try to focus on something for too long, you find that you just can't function. You're not making any sense. What you're reading or looking at doesn't make any sense. And that in itself can trigger depression and anxiety. So exercise for some person who's experiencing long COVID has to be really monitored closely, because you might pick up yourself and say, okay, look, I've been lying down in this bed for a few weeks. I want to get up, I want to move. But some people can't even get up from the bed and go to the bathroom. When they do get to the bathroom, they need to be helped back to bed. Some people might say, okay, I'm going to go downstairs and I'm going to cook a meal. And they might get downstairs and then they can't function for the rest of the day. For some people, the symptoms might be immediate. It can show up in 3 days, sometimes in 7 days. And you're wondering, well, what is the root cause of this thing? And it could just be that you walked downstairs 7 days before. And that was what triggered you to be so fatigued and so weak for the rest of the week.
Wow. There's so much, and we're learning even more. So let me ask you, because we talked about before your interview, people in surgery and PPE and how important it is. When you're doing the therapy, do you have to literally touch the patients to help them, and you're fully equipped? Because you have to do that. And so, Chris, for people,
one thing,
go ahead. Mm-hmm.
One thing that I must say, two things, sorry. Mm-hmm. When I first came to Harrison Point and I was shown all of the PPE that I had to put on and everything, because of how tight everything is and how there is muchness in terms of you're fully covered, sometimes you go in, nobody knows who you are because you're so covered up. So I write my name on my PPE so that patients will feel some connection to somebody when they see you. Yes?
Yeah.
Physical touch is extremely important. And there have been studies that have shown that monkeys, I'm carrying this a little bit as a sidebar, when monkeys are babies and if they're not touched, the way how they socialize is very different to monkeys that are touched. And this translates to humans as well too. When you're not feeling well, you can be an adult or as a child, human touch is enough to settle you. So yes, I hold my patients. I told my family yesterday, I got some serious hugs from my patients yesterday. They just held on to me and grabbed me and I said, once you don't tear my PPE, I will hug you right back.
That's actually a good one. Once you don't tear my PPE, I would. It's sad though with COVID-19 and how lonely the disease is, because
very.
And unfortunately, people, when they pass, it's not with a family member.
No.
nothing. And it's probably just people like yourself, Dr. Corey Forde, the nurses who do an excellent job, being the people there to see you.
It is a lonely way to go. What I like is that, for example, the staff here, they take a vested interest in the patients. If you come in and you are not necessarily in the same unit as your family, you're allowed to find out what's going on with your relative. If it is that you come in and you're in the same unit, they try to keep you together. Patients become friends with the person in the bed next to them. They check up on them. And if they see that something is wrong, they alert the staff around, look, I don't like how this person is looking. That's not how they were yesterday. So you become family among strangers. And I find that that helps.
Wow. So for you and your family now, how does that impact them? Mom having to be away for so long. Mom brought us back here to Barbados to go through this and lockdowns and all these kind of things. Mom, you must be taking some heat.
A lot. We were in Trinidad before, where it was a very tight and strict lockdown. So they just feel like, look me here, we're free.
when they got home to Barbados,
just to go to the beach and everything. It's been an adjustment. They've been in online school since March 2020. So it's just, they don't know what school looks like anymore inside, you know. So it's difficult for children to go through this. It's very difficult. Socialization skills down the drain. It's hard. It's hard. However, I've explained to them, they understand what's going on. And the hardest part as a parent is to separate what I see here and the emotional distress sometimes of being here versus when I go home, I've got to pick myself up and be mommy. And I've got to smile and play games, do homework, and act like if I did not have a bad day, if I had a bad day.
How does it make you feel when you hear, or if you do listen to it, because there's some people who tune out. You know, there's some negative feedback here about the people in the Harrison's Point, doctors in general. All of a sudden there's this movement of, you know, don't believe them, they don't care. So you, over the years, you know, you're accustomed treating people and doing good things, and nothing has changed. You're still treating people, you're still caring for them. How does it make you feel?
That's correct.
You know, when you hear these things?
It's very hurtful. I reached a stage where I had to stop looking at Instagram. I don't look at Facebook anymore. I don't watch the news anymore. And I don't listen to the radio. When my parents turn on the radio in the morning, they are big proponents of listening to the radio. And the first thing you hear is singing and then obituaries. So I turn it off because it's too much. I cannot handle it. So I just turn it off. It's very hurtful, but at the end of the day, I tell myself, those who know it feel it, meaning that the patients, they trust that they will get the best of care. The doctors give them their very best to the point where it affects them sometimes. And, you know, hearing the negativity, you have to work really hard to tune it out. Because if you take it on, it will really mess you up mentally.
And it certainly would, and that is why I say, and I want to share this with you, you're allowed one bad day in a month, and all you have to do is to wake up and say, not today. Today ain't one of them days. Okay? So
I love that one.
Well, I know, and I want to encourage you to do that, because people like you, and we're grateful, but there will always be people in the world that would not appreciate you. And not that I lean it back to me, but I'll share a joke with you. So Dr. Forde was on earlier, and he put a challenge out for Barbadians, which I'm hoping you accept the challenge to, by trying to get a vaccinated person, challenge a vaccinated person to find one person who's unvaccinated, to see if you can sort of talk to them, including you, if you found someone that says, look, I'm still hesitant.
Several.
So, right, so we want to think that. So I remember I put a video on Barbados today. Let me show you how negativity can seep in if you allow it to. You gotta
True.
laugh. You gotta laugh. You gotta laugh. You welcome the constructive criticism. That's fine. It's when it becomes
Exactly. Yes.
destructive that you really
Yes.
try to tune out. So one of the writers on Barbados Today, when I put that video out with myself and one of my friends from off the block, got him to vaccinate. He was cool. You know, we were happy. I was like, yes, vaccinated. So these dirty comments about, oh, they paid him. And I said, babe, that's that girl from Barbados Water Authority that come fixing people pipes. No, this has nothing to
Ooh.
do. There it is.
Oh, I saw that. I saw
Yeah,
that.
girl, that's me in a t-shirt and no makeup. And, you know, we don't wake up and look like this on TV. This is me, for sure. That's my friend Timar. And we were at Princess Margaret School. And he was hesitant. And we talked about it. And the good thing is he got another guy who spoke to him and asked him, and I was telling Dr. Ford earlier, so where you going to get the stick? And he asked what it was like. So the mere fact he called to ask him what it was like, and he shared his experience. This is all we are asking people to do. There is no conspiracy. No one is paying me for this. No
To
one
save
is
somebody's
paying
life.
Dr. Ford to come out to say, do the challenge. Dr. Ford, bless him and bless all of you that you do
Thank
what you
you.
do, you know, and there are people out there that care. But I said that to say this, that they
Yes.
went down a road, and the joke was for me, I'm not an engineer, I'm a communications specialist, so when they said, but that's the girl that couldn't get the pipes fixed at Water Authority, they thought, damn, when did I change my job? So, you know, so you laugh at it. But to you and all
Yes.
of the healthcare workers and the facilities and right across Barbados and even in the world, to you have one bad day. I'm going to have one bad day. And every day you wake up, God willing, today is not the day. And when you know you start like that, every day, it's like one of them stores that come and tell you no credit today, come tomorrow. And, you know, so this person says, I have issues on the left side of my face. It's very annoying. Do I look into issues like this? We're not asking you to self-diagnose, but does that sound more?
Yes. That's physical therapy. Yes, that's physical therapy. But I would strongly suggest that they either go to I think here you have to, yeah, they're gonna have to go to the GP and then get sent to a specialist. They'll just do some scans to see if there's any compression anywhere, and then yes, right after you should come to us.
Okay, well, that's physiotherapy is not only about age,
No,
right through.
from babies right up. We see babies too. There's pediatric physical therapy, very vibrant in Barbados, all the way up.
Well, I
Shout
can
out to
tell you about that
CDC.
with Sky, because you remember having Down syndrome, the muscles are somewhat, you know, weak, and I
Exactly.
had
Low
to do
tone.
all
Yes.
low tone muscles, and Lord, I remember going through all of that. Child did not walk until going on to 3, and I held the biggest party I
Right.
could hold back then. I said, no
Yes.
birthday party until I can get you to walk for that cake. And
I
she
love
did,
it.
you know. So those are the types
Right.
of things. Look, I don't know what tomorrow will bring. None of us do. And I think tomorrow will have
That'd be
its
great.
own problems. And we deal with
Issues. That's right.
today. And we're here,
Yes.
I'm here because we care and we certainly want to help. And I know the staff at Harrison's Point,
Exactly.
they want to do it. And right across all the facilities, I want to thank you
Yes.
from the bottom of my heart for coming here and for telling us and sharing what you do. And thank you for leaving
Thank you.
Trinidad and coming back home, girlfriend. You're home. Thank you so much. Okay,
Thank you very
thank you.
much.
All right. We'll be back after the break. welcome back to Face It and Fix It. As we wrap up, I want to mention a few things. We know that the Barbados Water Authority, they're having some challenges in the eastern part of the island in St. Joseph, and as a result, a number of areas are out, and I watched the show Water Wednesdays last night, and I'm wishing them well, and hopefully they will get it done quickly. They have a Facebook message here. My apologies, let me get it out quickly. Interesting, I learned a lot. I hope my people listening, Joanne, try to reach as many young people as you can. You're trying, and I encourage you to, Crystal Strong Bell, who just wrote that in. Encourage all of you Barbadians, please, each one, just reach one body. Why not ask you to go out there and ask 100 people to vaccinate? I'm not even telling you to go and beg anybody to do it. Just have a conversation with a person that you know that may not be vaccinated, that they're hesitant. Share your experience and see if you can then, with that information, allow them to make a more informed decision. Not everybody listens to the press conferences. But I just want to get back to the BWA and the fact that they do have some water issues. They did say last night it would take about 2 weeks to get things sorted out, and that the tankers are working around the clock. In addition to that, I am invited to a webinar tomorrow with the Barbados Lighting Power about their rates. So I will say this, I've said it before, I disagree with the rate hike at this time. During the webinar, I will disagree with the rate hike. And I'm hoping that Barbadians also continue to disagree, but they have gotten a different way of doing business through the FTC, the Fair Trading Commission, and we will sit and listen to them. They do deserve a break. I still love them dearly, but now is not the time to raise the rates in electricity, for electricity on this island. And last but not least, I'm going to mention the challenge again. During the month of November, all we're asking, all Dr. Forde is asking, he made the challenge. All I'm doing together with other people who do what I do for a living is to build on this challenge. Help Dr. Forde. Just reach one person during the month of November. He even changed it. He said the 15th, but he said, look, November 30th is fine. He said, vaccinate for your freedom, vaccinate for health reasons, vaccinate for education. Vaccinate because you want to find a girlfriend, vaccinate because you want to find a boyfriend, vaccinate for all of the right reasons, the positive reasons, because I know that there are people who take that vaccine not because they fear death or being sick. They want to travel, they want to do other things. So whatever it is that you want to get back to do, even if it's just to hug your granny because you didn't get a chance to do for a long time, just go ahead, think about it, get all of the information, get the facts, and then make your decision. We need to bring those numbers down, and we would all like to give ourselves a gift, this independence, the gift of freedom, the gift of being able to move around. My name is Joanne Haigh. It has been my pleasure to be here on Face It and Fix It. I want to thank all of my guests, viewers, and listeners in Barbados and around the world. Until we meet again, stay safe. I'll see you on Monday.